So this patient today, 50-year-old female, back pain and sciatica for 3 years. And during that time, she saw 3 other doctors, had an MRI, went through a course of care of physical therapy, had 2 cortisone injections, and this is the kicker. Okay, so she saw a neurosurgeon. So these treatments, the physical therapy and the cortisone didn't work, so the outcome for those therapies was bad. And then she saw a neurosurgeon. Neurosurgeon said, you have a really bad herniated disc and you've got these other complications going on here, so you need a fusion. He said, but before I can fuse you, I want you to go home and lose weight. And here's the problem. Her back pain was so bad, all she could do was sit in a chair. She couldn't even get up and get any exercise. So she was having a very difficult time losing any weight because his criteria was lose weight before you get the surgery. Otherwise, the surgery might not work. So she was sitting there waiting, hoping that something might happen that would help her lose weight because she wasn't losing any weight because she couldn't physically get any exercise. And she saw our TV show. We have a TV show on Fox TV on Saturdays and Sundays. And she happened to see one of those and she thought, well, maybe I'll go there. Our goal when you first come in is to identify what is the cause of your sciatica. There's 5 different causes. And we found out, here's what she had. She had a spondylolisthesis, a herniated disc, and her herniated disc was 1 centimeter, which is a big herniated disc. Okay? It was large. You'll see it. She had a degenerated disc and she had stenosis. So she had 4 of the 5 causes of sciatica. But her biggest cause was the fact that she had a very, very, very large herniated disc. Now be aware, she was scheduled for the surgery. She just had to wait till she lost some weight. So she was on that path. She had 4 of the 5 causes of the pain down the leg. Okay, I just want to review briefly the herniated disc. 24 vertebrae. Between each vertebrae there's a disc. The disc allows for motion of the vertebrae. More importantly, the disc is like a jelly donut in the sense that the outside of the jelly there's a thick material. Inside there's the jelly, and what happens is sometimes you can get a little tear in the outside. The thicker portion of the jelly comes out to the outside. Looks kind of like this. Jelly has come out to the outside. On an MRI, it looks like this. This is the herniated disc. This is not her herniated disc. That's her herniated disc. Okay? The one patient yesterday I said is pretty close to the biggest. This one might here be the biggest. This was a very, 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 very large herniated disc. She went through our program. What's the program? We take pressure off the disc and we do exercises to stabilize. We take pressure off the disc. We have you do exercise to stabilize. And the end goal is to free up the space where the nerve comes out. After she had the injections, after she had tried the physical therapy, her back pain and her sciatica was a 9. Okay, she had severe back pain. Again, she was struggling getting off the chair or out of the couch because her back pain was so bad, couldn't lose any weight. Doctor said, you gotta lose weight. Came in, oswestry was a 44. We talked about the oswestry. It's how we identify outcomes. It's patient-reported data. This is the score the patient gives. Answering question tells us how much disability you have in your life. Went through the program. At the end of the program, back pain was a 1, sciatica was a 1, and the oswestry was an 18. So patient got better. Patient got better. Okay? Again, she was in the severe disability category. We got her down to minimal disability. What that means is she's able to live her life. Okay? The story here is herniated discs go away. If you have a herniated disc, they go away. If you have sciatica and you're struggling, they go away because sciatica is a pinching of the nerve. And more often than not, it's a herniated disc. I mean, there's 5 causes, but herniated disc is involved often. Okay? Here's the beginning. Here's the end. So what's the story? Herniated discs go away. You don't have to live with it.